Good evening. My name is Sarah Walzer. I'm the CEO of ParentChild Plus. Welcome to Caring Through Crisis. On behalf of ParentChild Plus sites across Massachusetts, where we would be in person if only we could, we are thrilled to have so many of you join us this evening for a critical discussion of the role that early childhood supports play in determining the healthy development of children and families, and what communities can do to work towards educational equity. The past year has been difficult, to say the least. COVID-19 changed life as we all know it. It has devastated communities, it shuttered businesses and took away jobs. It made basic daily interactions infinitely more difficult. As a result, we are all facing unprecedented levels of isolation. But for those in historically marginalized communities, often without internet access, transportation, or safe outdoor space, it is so much worse. For these communities, isolation isn't just isolation. It is a further reduction in access to information, resources, education, healthcare, and food. It means children going without essential services at key stages in their growth and experiencing so much, too much trauma and stress. And existing disparities beget more disparities. For example, Black and Latinx parents are more likely to be essential workers and have jobs they can't simply log into and work from home. They are also more likely to live in childcare deserts and where schools have gone remote, leaving them with staggeringly few options for quality care and education for their children. As ParentChild Plus families know, the pandemic didn't create these conditions, but it has exacerbated them. The persistence of food deserts, childcare deserts, inadequate infrastructure, lack of affordable housing, healthcare, and quality schools raises important questions that will continue to exist when the pandemic is gone. How are we caring for our most isolated communities? How can we better understand the connection between healthy communities and children's well-being? How are we supporting parents and the other adults who play such a vital role in children's health and development? In other words, how are we taking care of our caretakers? Fortunately, there are early childhood, home visiting, and healthcare experts who focus every day on building and sustaining healthy communities, families, and children, and have continued to do so during the pandemic. We are honored to have several of these experts with us this evening for what should be a powerful conversation. Tonight, we are not only going to discuss caring through crisis, we are going to talk about how we care better after this crisis, ensuring that every family has equal possibilities from the start, no matter what. I cannot thank our panelists enough for being willing to share their wisdom with us this evening. And now, please join me in welcoming our moderator, Enarides Rodriguez, news anchor and reporter for WBZ-TV and CBSN Boston.
Thank you so much, Sarah. And hello to everyone watching us right now. You are likely watching us through YouTube, which is very 2021 of us. But this is what we need to do to stay safe, to stay healthy, and to stay strong. As Sarah mentioned, my name is Enarides Rodriguez, and I'll be tonight's moderator. I'd like to welcome you all. We really do appreciate your time, and we've got a great lineup of women ready to share their journey as providers. Women who are serving in our neighborhoods, who are our neighbors, our caretakers, all around really super women doing incredible work to strengthen families in our communities. To tell you a little bit about myself, I'm a journalist and I'm also an immigrant. My story may be familiar to many of you, just like the millions of families across the world. Mine has been impacted by immigration. I was born in the Dominican Republic and moved to Providence, Rhode Island with my family when I was 12 years old, and I spoke very, very little English. Like Celia Cruz would say, my English was not very good looking. And I actually had to learn how to even say my name in English. But coming from a family of educators, failure was not an option. So my parents had very high expectations of me. And when I almost flunked out of English in a freshman year of high school because I did not understand Shakespeare or Old English, they realized that I needed an intervention. And for me, that meant signing up for adult English classes. And I take those twice a week at Providence College, which was in the neighborhood that I grew up in. And I was also assigned a tutor. Long story short, my senior year, I graduated with an advanced placement English credit. And it took, and it still takes, a lot of hard work and sacrifice to achieve my goals. Now I am a mom of two amazing young boys, a 4-year-old and a 1-year-old. And my experience is helping me make good choices for them. And because of them is why I'm here today, because I believe that all families should have access to programs like ParentChild Plus or any other program that allows them to nurture and enhance their child's learning experience. And in a pandemic, that is now more important than ever. In March, it'll be a year since my 4-year-old, soon to be 5, will have been out of school, and we have all made incredible sacrifices. So in order for us to make sure that this challenge and this vulnerability doesn't become a fragility and we stay healthy and strong as a community is why we're all here tonight. So thank you so much for your time. You're going to hear from those working within the community, their learning lessons, what they're looking forward to, and what they've experienced so far in this pandemic. The goal of this conversation is to feel a deeper and emotional connection to this issue, and to understand the impact of COVID among our most marginalized families and their young children, to understand the link between early childhood education, the healthy development of families and communities, and the long-term health outcomes for children, and to feel inspired by this discussion and aware of how you can support families through this time. So let's all take a collective deep breath. I'm going to do it with you. Relaxed. I know everyone is in the middle of a very busy day. And listen in. I'm coming to you from Boston, currently hiding in a very busy newsroom. So our guests tonight are also spread out within this network, and you'll hear from 2 different panels tonight, and you'll have a chance to ask questions through the comment section. So make sure that if you want to participate, you shoot a comment, and I will be looking at it, as well as our team behind the scenes. So please help me welcome our first set of panelists, Andrea Tamkin, Lydia Brown, and Jessica Rodriguez. Hi, ladies.
Hello.
So good to see you all again.
Nice to meet you too.
So can we start with you telling us a little bit about the Parent-Child program and what role you play? Lydia, why don't we start with you first, and then we'll go around.
Okay. So the role that I play is coordinator. We have a fantastic program at the Boston site. I have 7 early learning specialists that work with me. We are scheduled to serve about 104 families this year. I started off as a full-time home visitor back, I must have been about 14 years ago. And I was able years later to get the opportunity to coordinate the program. And here I am. We work with culturally diverse families. As you know, Boston is culturally diverse, so we work with parents from all over the world, Central America, South America, Asia, India, Africa, the UK, it's a great program.
Yeah, Jessica, you're able to, obviously being fluent in Spanish, like Lydia alluded to, connect with immigrant families. Tell us a little bit about the role that you play also.
Definitely. So I am also the coordinator for the Parent-Child Plus program here in Fall River. And we currently we have a smaller program. We have 32 families with a big wait list. Our need is very, very high. We do serve mostly families that speak Spanish, Portuguese, and English. And you're right. It's very important to connect with families, for families to connect with people like me that speak their own language and understand their culture.
How about you, Andrea? What role do you play, and how long have you been with Parent-Child Plus?
Hi. So I've been with the Parent-Child program for over 20 years. Originally I started as a home visitor and then sort of worked up as to a supervisor. And at one point years ago, probably before Lydia came, I also coordinated, and then the program sort of got cut and picked up in Dorchester. And but so now I'm back to home visiting and co-coordinating. But my love was really working with the children, not administrative. So I found my way back to home visiting with again very diverse families, and it's just a job that I've stayed with from the time my son was about 3 or 4, and so that's how I know how long I've had the job. He's 22 now.
Now,
And I don't
Andrea,
know-
go ahead,
I'm
Lydia.
sorry, I was going to say, I don't know if Andrea mentioned this, but Andrea pretty much hired me on as the home visitor, and she was my supervisor at one point. So
Wow. So you guys have really deep connections to your communities. What inspired you? Andrea, you mentioned you loved working with kids. What inspired all of you ladies to, be part of this organization?
I did not have a direct route, actually. I was art. I went to school for art, fine arts, and an art educator. I worked in Brookline school as after school, and then after I had my son, I worked in daycare, family daycare, and the daycare provider at that time had a flyer about the position at ParentChild Plus, and she kind of regretted showing me the flyer, but I thought, yeah, that's kind of the job for me. Because also I had just had a child and I wanted a little bit less, more part-time position. So when I started there, I was much more part-time, but it was such a good fit because, again, I love children, but I also realized how much I loved working with families. I always loved talking to the parents and supporting them. That was my route.
Yeah. How about you, Lydia?
well, I've always worked with families. I have my bachelor's degree in human services, so it's always been my goal to work with families. It's very important to me because, many years ago, when I needed services, and this was before personal computers and Google, it was very difficult for me to find resources, but finally I did, and I was able to move up a level in my life. So it became important to me to kind of give back and to help families to do the same. It's important to me to try to change mindset also. So I remember one of my first jobs after I graduated, I worked in a preschool, and I heard a parent, a teacher was giving additional work for this parent to do with their child at home, and and the parent said, that's not my job, that's your job, you're the professional. And
I've heard that before.
and it just it just stayed in the back of my mind. So years later, when this position came up, I thought, oh, this sounds really interesting, because then I remembered what that parent had to say. And Parent-Child Plus, the goal is working with that parent to realize how important they are, and they are their child's first teacher. So luckily, Andrea and others hired me on, and it was my goal to visit these families to try to change mindset, and try to and let them know how important their role is as first teachers.
And I'm sure Parent-Child Plus feels very lucky to have you on as well. Jessica, I know you've got your 2 little ones running around, and you take that responsibility very seriously. I know your watchful eye is watching them as you're sitting there talking to us. What inspires you every day to continue to do the work that you do, and why did you become involved?
So as you, Anarides, I came to the United States as a teenager. So I know the struggle of coming to a new country. I was given the opportunity to work for the Florida Public Schools first in the registration office. So I was the first person that those families were looking at when they came brand new to this country. And I knew the fear in them. I knew what they needed. And I felt so blessed to know the information I knew from living in this community and being able to guide them and give them those resources. So and I agree with Lydia that it's very important to change that mindset. Once you give parents the empowerment and you say this is what you have and you are able to use it to be your child's first advocate, you see a transformation in parents, and I think that's very important. But yes, my two children definitely inspire me. I want all children to have the same benefits that I'm able to offer my children. And it's very important for all children to be able to have that.
Obviously, given what we're doing right now, we're all meeting virtually. The pandemic has really changed everything. Jessica, in our previous conversation, you had mentioned that the most obvious change is how you're connecting with families virtually. Can you talk to us about the benefits and the challenges of that?
Sure, definitely. So I had mentioned before that I feel that our role hasn't changed. I think our role has always been the same. The goal for the program has always been for us to empower parents, to give them the skills that they need to be able and go out there and, no matter what adversities they face, to be able to be their child's number one supporter. And going virtual, I have to say, it hasn't been the easiest, especially in the communities that we worked in, because parents don't have an extra iPad sitting around that they can connect with you. But I think it takes a lot of care from people like us, from people like the early learning specialists that take the time to go into the homes, develop a really strong relationship with these families, and walk them through whatever adversities they're facing. And if it's just connecting them through to a Zoom meeting to do their weekly visits, we're there to do that. I do feel that with the pandemic, our service delivery changed a lot. I think we had to adjust our program to what the parents needed. And again, that's always what we've done. We've always adjusted to what the parents need. And I feel that with the pandemic, those concerns that went to the next level. It wasn't just early childhood anymore. We weren't just helping with early literacy skills. We were helping with so much more. Early learning specialists were now bringing food pantry information that was vital to those families. Those food pantry flyers were not an option anymore towards the end of the week. Those food pantries were now their only source of having a meal on their tables. So I
Yeah.
think our service delivery changed a lot because we're not just delivering books and toys to families. We're giving them so much more, and we're meeting all other concerns that the families are facing now.
Lydia, I see you nodding.
Yes, I do agree. For my early learning specialist, what stands out in my mind, we're doing basically, what Jessica's site is doing. But we were just exhausted. Early learning specialists were exhausted, but because it wasn't just doing the program, the sessions with the families, but families were calling early learning specialists like in the evening and at different times of the day and different days of the week, because yes, they needed that lifeline with services, but they also needed to talk. And that was very important. And so, the early learning specialist, never said, sorry, this is not a scheduled session. They were just there for them to just listen. And not only that, but even with resources, the city had a lot of financial support available. And we give these, this information to the families. But, a lot of the families, because of language barriers, they're very uncomfortable, trying to apply for these services. And, and back then, if you went into one of those portals, it was very, very lengthy and exhausting. So early learning specialists, they stepped up and they took the lead on it. They helped to apply for these services. And at least one of my early learning specialists, she would text me pictures of these happy parents holding up a check for $300 because she applied for them. And, they were just so grateful.
Andrea, I know that you had several anecdotes of things that have happened to you with certain families as you provide them with services that you necessarily didn't think that you were reaching them, but you had a couple of those aha moments. Can you share those with us?
Absolutely. I did. I found like our families are struggling, but they also could rise to the occasion. And sometimes, like, there was not a direct route. Like, often clothes would come from cradle to crayon, but during the lockdown, families weren't able to apply for certain things. I took the initiative to actually reach out to my community. I live in Jamaica Plain that has a everything free JP. And I was actually able to go around with people who had, clothes. Well, this one family had a baby, and she really had very limited clothes for the child. And she asked us, could I get some clothes? And I did. I went, to people on this site who were able to, because Cradles to Crayons just wasn't servicing people yet. And also driving around to the diaper pantries. And sometimes they weren't able to get to the diaper pantry, and the lead agency that we work with had diapers, and I would get them diapers. And we also had gift cards for Stop and Shop that we were able to get for families. So there was, a lot of problem solving and helping families, at the holidays with turkeys and food and
Christmas gifts.
Sorry, Lydia?
Christmas gifts.
Yeah,
Christmas.
the Christmas gifts. Oh, yeah. Well, we had other agencies that also asked for specifically what the children would want, and we filled out paperwork for them. And I know how happy a couple of the children that I visit were to see, a stroller with a baby doll, or, whatever they got. But it's, our role certainly, there was a pivot there, and we caught on very quickly what the needs were, what we would need to do. And I don't think any of the early learning specialists ever, gave it a second thought. They were just ready to do what they needed to do.
Right.
So I feel like it's a privilege to serve people, and they love it. And they love the program also because the children have totally connected with us, even on this little screen, in this little window box. They see who we are. And when I've come in person to deliver something, even with a mask on, I know one child just screamed with delight when she saw me in person. So I feel like it's really great.
We also have to remember now more than ever, all those children are in isolation. And sometimes we are the only person from the outside world that they get to see. And on top of it, you're bringing them toys and books. They're going to love you. They're going to have a smile every week.
I love that.
Well, I wanted to mention too, with these children, they get used to the routine of, this program. And it just becomes normal, for them in this world that's not so normal right now, to have, an early learning specialist coming into their homes, well, virtually that is, twice a week, and they look forward to it. They absolutely look forward to it.
We need that routine, right? We need to maintain that routine and that structure with children. And it's just incredible to hear that. And I see it too in the newsroom, that despite all of this, there are people focusing on the good. There are people organizing to help their fellow neighbors. So thank you so much to all of you for your commitment to your communities. We have only a couple of minutes left, and I do have some questions. So I will pick one question that I'll ask all of you to answer briefly because we need to bring on our second panel. And this question is from Kate Worrell. I hope I'm pronouncing your name correctly. If I'm not, I apologize. What do you wish more people knew about the work you are doing or the families you serve? Anyone? Go ahead.
Well, I would like to say that this program, you know, it sounds easy. That, you know, we're going in, well, in the normal world, pre-pandemic, you know, going into homes and we're playing with children and bringing them books and toys, and it all sounds like fun, and it is. However, it's a lot of work. It's a lot of work because, you know, we're looking at these children as individuals, and caseloads for my early learning specialist can go as high as 14 families. So, you know, with each family, you're looking at that child and, you know, you're assessing what their strengths and what their weaknesses are. If there are any weaknesses, we bring additional materials to help bring them up to their developmental milestones. And if they don't reach the milestone, then, you know, we have that conversation about early intervention with the parent. So, you know, just think about that going from one child to the next, and they're all completely different. But it's very tiresome. I remember when I was a home visitor, I was completely drained by the end of the week, but I also knew that I was doing my job the right way. And that also goes with the parent. You know, I've seen a lot of, you know, depression going on in the home, and each home is different. So with this program, it's 23 weeks. What happens is that, you know, trust is formed and a relationship is formed between the parent and the early learning specialist. And when that happens, the parent opens up a little bit more about the family dynamic. And then that's where we're able now to really step in and, you know, give them the resources that they need to go to the next level.
And we'll leave this on a final note, ladies, because we are running out of time. And Lydia, you mentioned something that's so important, and that is mental health. And someone asked, Euridice Jimenez. I think I got it. She says, what do you do for self-care? Give me one sentence, and then we'll let you go.
I can tell you.
Go ahead, Andrea.
Well, I do some yoga, weight training, and walks in the woods with my dog.
I love that. How about you, Jessica?
I do have to say, I have two little ones at home. So sometimes those 2 minutes before coming into the house, just taking a deep breath in the car, and it's okay. It's go time.
That's right. We need to remind ourselves to breathe sometimes.
Right.
Lydia, what about you?
I'm still learning. I hate to say, I'm still learning how to do that. You know, because, you know, I'm working constantly, but I know I'm working for, you know, the betterment of families. So I'll get it one day.
Well, we thank you so much, and we are so grateful for your commitment. It was great to talk to you, and I hope to meet you in person someday.
Hope so.
Hope so
All right,
too.
thank you.
Thank you.
Bye, ladies.
Bye-bye.
Okay, so up next, we want to bring in our second set of panelists, and they're going to talk about the impact that a program like ParentChild Plus can have on a child's overall health as children and over the course of their lives. So please help me in welcoming Dr. Thea James. She is the Associate Chief Medical Officer at Boston Medical Center. I want to also welcome Dr. Genevieve Daftery. She is the Pediatric Medical Director at Common Square Health Center in Dorchester. And Miss Cynthia Seggi, Family Support Coordinator in Great Barrington. Thank you so much, ladies, for your time, for taking some time to talk to us out of your very busy schedule. Dr. James, I'll start with you. A common term in healthcare these days is the social determinants of health. For the non-healthcare people at this event, can you give us a brief explanation of what that means?
Okay. So the definition of social determinants of health is the conditions in which people are born, live, work, age, and a set of situations and circumstances that determine their quality of life and quality of life course trajectory, and what they'll be able to achieve and that type thing. And I think one way in which I can explain how those things actually manifest is more and more I've sort of been reflecting back on what's happened over the last several months, like back in 2020. And I think the thing that struck me the most about last year, I mean, really, really struck me hard at some point, was hearing how many people were saying they didn't know. People just kept saying they just didn't know, that all these things were happening to people, and they were, people of color, and they were experiencing all these things. And so um, at one point, our healthcare plan hosted an author of a book called um, I'm a Good Person, Isn't That Enough? And this lady really helped me understand some things, because she said she grew up in, her name is, what's her name? Debbie Irving. And she said that she grew up in Massachusetts in a very, very progressive, leftward leaning family. And that, they didn't talk about race a lot. And she would say that her parents were like colorblind, but she was surrounded by all of these sort of myths and things that if something, was happened to a person of color or whatever, there were these explanations and myths that they were, these things happen. They're good people, but they just don't make good decisions, or they're not as smart, they're not as competent, they don't work as hard, these types of things. And so, there are two issues there. I mean, there's the narrative of that, and the problem with that is it actually influences how people behave and how they act. For example, people will look at people like that and all of a sudden just say, well, this is you come from here, so this is what you get. So in fact, they basically sort of set low bars for those folks, for us folks, I should say. And those bars become self-fulfilling prophecies. The other thing is, like, there are real structural systemic barriers. And I think that's the piece that people didn't know. And people don't understand, as we go forward and do all the things we're trying to do to actually alter the quality of life trajectory for people. If we don't understand historically how these things happened, as most well-meaning people were just inclined to recreate the same structural barriers. And so it always is important to understand how and when all these things started way back in the 30s. And I really feel like I'm saying this more and more, and probably too much, but when we were at a time like now, when the economy was really doing really, really poorly, and our president at the time was trying to find a way out, to resuscitate the country, and he created these pathways to building wealth in the country for people. And as you know, the most common pathway to building wealth in America is through home ownership, because of the benefits of home equity. So it was a brilliant plan, except at the exact same time, they created policies that created redlining. So if you lived in those neighborhoods that were behind the red lines, you didn't have access to that pathway. And so you couldn't even access financial services. It was the exact same time the 30-year mortgage was created. Housing developers were being subsidized and paid to build more housing only if they agreed not to sell it to people of color or rent to them. And so it essentially created two socioeconomic populations. And these many years later, it exists to this day. And those, just final thing I'll say, those red lines, those geographic areas were the exact same areas where there were the high rates of COVID and high deaths of COVID to the same people. So that is an example of social determinants of health, because those people, it's the reason why we have this median net wealth gap of $267,000, $47,000 for white people and $8 for Black people in Boston. So you see how that can manifest over time. And children and parents, it's critical, because most of what has happened to children and families is multi-generational. And people who earn less money and have lower education have poor health status, and even for children, because they are only merely beneficiaries of what their parents have. So it's really, really important to focus on these things, and more than just giving just the charity piece of it, but also the equity piece, focusing on financial stability, economic mobility, and opportunities to build wealth, because that way they can take care of all these domains, housing, food, all those things themselves, and change the trajectory. And everything I've heard already in the other panel, like mindset transformation, those are like spot on. Those are the things that I think will get us there. And I'm really
And
optimistic about that.
We're so happy to have you all here. Dr. James, and you touched on something that really, if you understand this, then you understand privilege, right? In my reporting, I was among the first in the community of Chelsea to sound the alarm, at least in the media industry, to say, you know, we're seeing high infection rates in Chelsea, and it's all connected, right? We have 80% of people in Chelsea who don't have the luxury to work from home, who are essential workers. And it all factors in to what they're experiencing, right? Ms. Segi, let's talk about, can you tell us a little bit about your colleagues at Community Health Program and the engagement that ParentChild Plus has with children and families at the health center and how it impacts their health more broadly?
Okay, so I'm a coordinator for the South County program, and we work out of Community Health Programs where I work, which is a huge health center. And the connection between the program and the health center greatly directly impacts the health of the families for obvious reasons. But we're a federally qualified health center, and being that we see some of the most vulnerable populations, we see the underserved families that live in rural communities that face food insecurity, housing insecurity, homelessness, partner violence, discrimination, immigration issues, substance abuse, isolation. I mean, it goes on, right? All the underserved communities with all the trauma that they face. Those are the families that we serve. And so being connected to the health center, it gives them the advantage of being connected to a plethora of services. So through the goodwill and the trust of the home visitors that I believe it was Lydia had mentioned, we were able to facilitate access to these services. Being the coordinator, I collaborate daily with nurses and doctors and nutritionists. I work closely with the WIC program, with early intervention services, with early education educators. So that, again, just it facilitates being able to access these families to the services. And then just at the health center itself, we have a ton of services for these families that address the social determinants of health. We have food programs, we have the WIC program, we have grants for financial and security, so we can help with bills and rent and mortgage. We offer social support through our play groups. Now they're mostly virtual, but we still do have some outside with social distancing. We have diapers, which anybody who works with this population knows that's a huge cost and a huge need. We have breastfeeding support, and all this is happening virtually now. We have support groups, parenting classes, and then last but not least, we have the mobile health unit. So we can actually go out to the communities where these families are living so that we can get to them because they can't get to us because of lack of transportation. Being in the rural community, transportation is a big issue. It's a big challenge for us. So, I mean, speaking of the social determinants of health, with PC Plus, we hit on education and literacy, and then being connected to the health program, we hit on health services, social support, and just healthy child development. So it's a direct correlation with the two programs. It's a huge advantage, I think, coming out of, although any program that the PC Plus program is housed out of, it's an amazing program. But we do have that extra advantage when it's in a health center.
Yeah, I'm sure. So, Dr. Daftery, your dealing with these families in person. As a pediatrician and the pediatric medical director at Codman Square Health Center, you're in the position for caring for children over the course of their entire childhood and seeing them grow up. So can you speak to the power of an early childhood education program like this one and what you notice when you visit with families?
Yeah, I mean, it's so powerful. And I think, my role as someone who gets to walk alongside parents as their kids grow from that first newborn visit that we have until the adult that graduates from my care into another PCP's care is a really important journey. And that first newborn visit, when I walk in the room, I'm from the get-go trying to think through how with this parent are the two of us going to support this child, maximizing all the potential that's in this little being from like day one. And I know that's what a parent wants. And we each have as parents our own sort of like direction. And I'm there as the pediatrician trying to interject a little bit about, the health information that I know that may help contribute to that course, and really be a cheerleader and a coach for that parent too, as they make different decisions along the way. And it's interesting because I think as we've done this work more and more, even here at Codman, which is another federally qualified community health center, just like Cynthia is referring to, in a different place, in a very urban setting, with a patient population that probably skews a little bit more Black than it does Latino, but still has that mix. I realized that even with the great number of visits that a primary care pediatrician has with a family over the lifespan, that's still so few touches relative to the day after day, the many other moments of potential between that parent and that child, and between that child and the other educators in their lives. And so I'm always so curious about those other moments so that I can talk with a parent about how those are being maximized and help them find and create more of those moments when possible. So when I hear about a program like ParentChild Plus, I think, okay, this is this other opportunity when I'm not in my 20 to sometimes stretching to a 30-minute visit, because I know how important it is to talk about that next anticipatory guidance thing. Someone else is going to pick up that ball and run with it with that parent. And if I can get the parent curious and questioning and engaged, there's somebody else who's going to be picking that up. And we see this in other early childhood education settings too, but that's the power of it and why it's like something I'm always curious about and asking about contextually when I go into a visit, because they're up against so much. Dr. James laid out so beautifully. I know when I go in that room, if all I'm going to say is, hey, it's really important to read before bedtime every night. Make that a part of your routine. If I'm saying that without the knowledge and the context of what it's like to try to create that routine, if I am living in a scatter site shelter and I have twin toddlers and I'm putting them to bed next to a mom who I may not know, who has a 4-year-old, who is not interested in me extending the bedtime to include a story, it's tough. You can't lose sight of that context as you're walking alongside folks. And still you want to give that tool of reading. So what are you going to do to advocate for the importance of that early childhood learning experience of reading while really holding at the same time and advocating for the improvement in the context in which that family is trying to do that tough work of raising a really healthy kid?
Wow, your patients are very lucky to have you, doctor. Thank you for that testimony. Dr. James, I know that you're not a pediatrician, but can you reflect a little bit about the role of early childhood education and how that improves the health outcomes for families in these communities?
Absolutely. One of the things that I'm an ER doctor by training, and one of the things that I have found out over the years and I'm an adult ER doctor, but I have also, trained in the pediatric department as part of my adult training, but also I used to moonlight there as well. But even as an adult doctor, one of the things I learned a lot about parents is, people don't understand why people are in a cycle, why they see the same people over and over coming in the same stuff always. And I never have a narrative in my mind about why that's happening until I ask them. And I ask them a very simple question most often because there's no question to ask from my perspective to get to understand how to stop this. And I ask them, what would it take for it to never happen again? And it always generally boils down to people not being, having limited resources and trying to survive. They can't even prioritize health. They're trying to take their limited resources to, they pay rent, pay utilities, feed the family, and they can't even oftentimes have the time that they need, to spend and that type of thing, with the children. So they can't prioritize some of these things. But what I have found is that when there have been opportunities for people to engage in these things, because we often ask what matters to them, a lot of people feel like it's that narrative again. They don't think people will choose things like education, for themselves, even and for their children. I mean, I remember having to advocate for when we started screening people for determinants of health. I had to advocate for putting education and employment and income, things like that, on the screener. And those things screen up there right with food and that type of thing. So I'm saying this to say that obviously it's incredibly important because as I said earlier, it is really tied to people's health status as they, progress along in life. And it is not lost on these parents how people get ahead in life and have healthy lives, because they choose those things above, all things. At one point, I had to ask the people in the room, who were giving me pushback, how did you get that job? And how did you get that job? And how did you get that job? It was all through like education, and early education, and continuing on and on and on to make yourself be able to avail yourself to opportunities. And so, again, these things become multi-generational when they are not addressed and the cycle is not broken. It's incredibly important.
So in staying with that note about this, us supporting our communities, Ms. Segi, lastly, you're going to get the last word before we take on a question. Mental health came back up again, so I want to bring that to you ladies. But from your vantage point and having a parent-child program in your community health center, what do you need most to keep providing the support to families in the community?
Well, now, of course, in the environment of the pandemic, it's technology, right? So we need resources so that we can get technology to families. And I think that's something that the previous panel also touched upon. We need to be able to provide them with an iPad rather than having them on their phone, to give them hotspots, to get them funding for data plans. So that's really the biggest challenge that we're facing right now, because people want to engage. They love the program. It's undoubtedly life-changing for families. It's an unbelievable support for them. But if they don't have the technology, it can't even be an option for them. So that, I think, is the highest need.
So we've got a lot of feedback from our viewers, thanking you all for your contributions. One question that I want to ask, because it keeps coming up, Christy Young wants to know, what are your concerns for the mental health problems that are increasing because of the pandemic? Is our state, our schools prepared for the level of crisis that may emerge? And you're all open to share your thoughts on that.
I think I'll tackle the first part, and then I'll make someone else answer the hard question of whether we're prepared or not. So I think it has been striking to see what is happening, because I am continuing to see patients in person. Obviously, well child care is one of those things that is very challenging to do via telemedicine, and so we are still doing, for vaccination purposes and monitoring of growth and development, I'm seeing kids in person. And I haven't had a truly well visit since, March of 2020, because every child that comes in, every family is experiencing just incredible amounts of stress. And it's certainly on a spectrum where some are using all different sorts of resources and coping strategies and getting through in certain ways. And then there are some who really cannot, either because of the intensity of it for them, or because they were already extra vulnerable in some way. And this is from from really young children, like we're talking about here today, where there are behaviors emerging where parents are questioning, like, is this autism? Why are their temper tantrums so extreme? And then, oftentimes it's just the isolation. And what does isolation mean for a young child? It means they're not getting some of the routines and structures and socialization that is typical, and that they really need to thrive and grow. So, I think it's a real challenge, because so much of what we are going to see is a normal reaction to a highly abnormal situation, and trying to tease that apart from something that's become, really so functionally intense that we need to provide more formal support is tough. So I think we really need to have a very responsive system that is prepared to not necessarily label something as depression in a 3-year-old, but respond accordingly to treat it just as seriously as if it was, because that's how we're going to prevent the real depression that will emerge if we don't get on top of that. And I would say preventative mental health stuff is a harder thing to advocate for across the board within healthcare. Preventative services have always been tough, but preventative types of mental health is tougher in a situation like this where we all need it.
Dr. James?
No, I agree with Dr. Daftery. I would say it's already emerged. And, what I would say is, our behavioral health clinic, for example, the no-show rates used to be extremely high. And now the no-show rates are extremely low, and they're all telehealth. So I don't know if it's the convenience of telehealth, or the pandemic, or a combination of the two. But there's a lot of need out there already, and I do believe that it needs to be. It's probably not enough. We need to get in front of this a little bit more, particularly with children. And so I would say it's something that's really on the radar, and that we should keep our mind on. But I also want to say that I'm very optimistic about all of this. Every bit. I'm an optimistic person by nature, but I believe that that we can transform, that we can get this done. We can get back and be better than we were.
And I'd like to briefly comment also. I'm actually an LICSW, so I used to be a therapist. I'm not practicing now, but I'm very involved in the therapeutic community, and I'm on several coalitions where we talk about this constantly. And it is a challenge. It's more of a crisis than a challenge, because there is a deficit of therapists. But my answer to that is on line with Dr. James, is that we just have to rise to the occasion. There's no other option. And we know that people that are in this profession are highly dedicated people who are passionate about what they do, and they will just do whatever they have to do to meet the challenge. And we've been talking about, trying to form groups therapy groups, so that we can accommodate more than one person at a time, to kind of, so people, I'm sure this is happening all over the country. Therapists are just brainstorming on what to do, and they're taking on way more clients than they ever did, but there's no option. We just have to rise to the occasion, and that's what therapists they do. Anybody in the social services, you just do, right? So I'm optimistic as well. I think that we will conquer this, but it's going to take an effort on everybody's part.
And you know what? I'm optimistic after meeting all of you because you're absolute rock stars. And I am so grateful that you're out there in our communities helping families in need. And I thank you on behalf of everyone who's watching right now for your commitment and your contributions and for being part of this very important conversation. It was wonderful to meet you all, and I hope to meet you in person someday. You enjoy the rest of your night and keep up the good fight.
Thank you.
Thank you. It was a pleasure.
Thank you.
Bye-bye. And now we would like to welcome Sarah back. She has some closing remarks before we say goodbye.
Thank you, Henry, so much for that. Those wonderful panels. And thank you once again to all of our panelists for joining us this evening, but really more importantly, for the incredible work that they're doing every day. It is, I'm going to take Dr. James's message that we should feel optimistic. And one of the reasons we can feel optimistic is because there are these amazing social service people out there doing incredible work in our communities. As ParentChild Plus staff observed on this event, this crisis has precipitated dramatic changes in the lives of children and families who we work with. Thankfully, as we also saw tonight, there is so much that we can do to support families and communities, and so much expertise to guide us along the way. Even before the public health emergency began, too many families in America, and especially in communities like those Dr. James, Dr. Daftry, and ParentChild Plus staff work, were not receiving the support that they needed. Now we've reached an inflection point. If our country continues to neglect parents and young children, particularly families of color and immigrant families, it will be devastating to their future and to the nation's. Caring for parents and caregivers through supportive programming and resources is the best investment we can make in the next generation. Parents are not just their children's first teachers. They are the most important teachers, they're advocates, they're lifelong support system. By supporting parents and families early, we can ensure children's healthy development. Programs that are caring for families through this crisis are doing critical work. The Codman Square Health Center, Boston Medical Center, and ParentChild Plus sites across Massachusetts, across the country and the globe are supporting families' essential needs and well-being through healthcare, food, housing, and by providing the encouragement and tools to read, talk, and play, even virtually. But there are still too few of these programs reaching too few families. We can change that. Now more than ever, we all must come together to help make sure that no family, no child, no community is left behind. This is a moment of change, an opportunity for all of us to build a future that reflects our values and what we know children need. Now more than ever, we must care through crisis and beyond, no matter what. Thank you all so much for listening this evening. We look forward to ongoing conversation about all of this work and to bringing these panels back because they were amazing. Thank you so much. Stay safe.